in particularly challenging times. We are writing history. There are so many unknowns on so many different levels, but at the same time, there are also some things that we are learning, and some things that we have learned from the past and that we can also apply in this situation today. And I think the interesting part of the InsSciDE project is that it actually really looks into what we have learned in the past in the science diplomacy context and how we can apply that to develop a European strategy on science diplomacy. So again, I welcome all the participants to this webinar. I welcome our distinguished speakers. Thank you very much for being with us. As I said, it is part of the InsSciDE project, and UNESCO is very glad to be associated with the InsSciDE project as one of the partners. And in this particular webinar, we are going to kind of follow up on the webinars that have been organized between yesterday and today, which looked into the different actors and the different impacts of COVID in the context of science diplomacy, looking into the research areas, looking into some economic impacts, looking also into some theoretical and conceptual parts in this context of science diplomacy and health diplomacy in particular in our current COVID-19 situation. So this particular panel will have a look, we'll go a little bit beyond the borders of Europe, and we will have a little conversation with our distinguished participants with regards to some initiatives, health diplomacy initiatives across different continents and in different other places. We will have a look at what are, international institutional challenges and also opportunities, because I think we have all very much realized in this particular crisis how much we are all connected and how much there is nothing we can do alone, and how much really we have to work together at the international level. There were some good examples of international collaborations during this pandemic. There are also some others that were not as good in terms of international collaboration. So I think it's going to be extremely interesting to hear from our speakers what their experiences are, what their lessons are, and what are maybe some recommendations for the future, and in particular for this project that we are part of today. So without further ado, I think I'm going to just introduce our speakers and start with our conversation. We have Dr. Benjamin DJOUDALBAYE, who is the head of the Division of Policy, Health, Diplomacy and Communication at the Africa CDC. Thank you very much for joining us and for being with us. We have Dr. MARIE-PAULE, Inserm Research Director and the former WHO Assistant Director General. So WHO is the World Health Organization, for those who maybe do not know. Thank you very much for joining us. And we have Professor SACHIN CHATURVEDI, who is the Director General of the Research and Information System for Developing Countries. So very interesting panel, and we hope to learn a lot from you. And also I do encourage our participants to also post their possible questions or comments or ideas, suggestions in the chat or in the Q&A box. I think we have all learned in this past few months how to use all this technology and how to interact virtually. So we will be able to track your comments, respond to the questions, and have this conversation in this virtual mode. So maybe I will start with the first question to Dr. DJOUDALBAYE. What does health diplomacy actually means in practice at the national, regional, international level, institutional level as well? If you could give us some examples and your experiences, that would be much appreciated. The floor is yours.
Thank you very much for associating me in this panel alongside esteemed colleagues across, let's say, the world, who are committed to strengthening health diplomacy. And as we mark 7 months since the first case of COVID-19, especially for us in Africa, we bear several experiences and learnings to reflect on. I wish to extend my gratitude to the organizers for providing an avenue to exchange experiences on health diplomacy. Health diplomacy, for our point of view, is the practice by which government and non-state actors attempt to coordinate global policy solutions to improve global health. And it brings together several disciplines, such as economics, trade policy, public health, international affairs management, law, etc. And health diplomacy, more than ever before, involves a multiplicity of actors, not all of which are representatives of states and occur at various venues, formal and informal, and at diverse levels of authorities. So this is, in short, what health diplomacy means for us at the African Union family as one, and particularly at Africa Centers for Disease Control and Prevention, and by extension to the national governments in Africa, to the regional economic communities and the other regional bodies, and also for, I think the continent has one. Thank you.
Sorry. Thank you for that. I just needed to unmute. Just a little follow-up question, maybe. How some concrete maybe initiatives from the continent on health diplomacy, and or maybe from other parts which were useful in tackling the crisis from your point of view?
Okay, for us at African Union, health diplomacy is really not new. You know, health has been a major preoccupation, both for the African Union as well as its predecessor, you know, the Organization of the African Unity. And let me go back a little bit to the story. The Charter of the Organization of the African Unity, OAU, provided for the establishment of the Commission on Health, Sanitation and Nutrition, and the establishment and the first conference of independence of independent African states that took place in 1963 in Addis Ababa, agreed to set up a committee of experts to document health problems facing the continent and propose solutions. So this is how, you know, far we have experienced health diplomacy on the continent. And the WHO became the first United Nations organization to sign a cooperation agreement with the OAU on September 1969. So, you know, we have experienced health diplomacy for so long. And in Africa, for instance, when during the different high-level meetings at the UN level, like the high-level meeting on HIV/AIDS, for instance, we as continent, we always go there with a common position. And what we mean by that? You know, we organize consultations across various sectors in Africa. Well, we go region by region to organize consultations, including all stakeholders, civil society, you know, state actors, other non-state actors, communities, religious leaders, and other faith-based organizations. We bring them together, and they have their position. So when it is done at the regional level, then it comes for a continental consultation, and we consolidate all the input into one document. And then this document will go to the other sectors. For instance, it will go to what we call the Specialized Technical Committee on Health, Drug Control, and Population. And this is where we have all the ministers of health and other sectoral ministries who have to deal with health issues. They come together, they look at the outcome, they provided input. Now it is all consolidated in the continental position. And then we take to, for instance, New York for the African group there, and it will serve as the base of negotiations for the topic in discussion. So this is how we experience health diplomacy on the continent. So it is very old process for us. Maybe it was not called health diplomacy then, but today we have the correct terminology and known as health diplomacy. So let me stop there. But I can elaborate more and more. We have several examples on the continent on the different areas. Yeah.
This is really useful and very very interesting, and it is true. I mean, health diplomacy, we call it this at this stage, and we start to understand what it is, but it's not something new. It has just been maybe called in another way. And that actually brings me to Dr. KIENY. Health diplomacy or international collaboration, maybe around health issues. You have a lot of experience with that. What are some of the practices that we are seeing today in the particular case of COVID-19, and what are some lessons that we can learn for the future from that?
Thanks a lot. Indeed, health diplomacy is a long practice, and it's a question of using health and sometimes also help in the area of help to push one's advantage or one's point of view. And you can see that, this has a typical example, for example, is the approach that the Cubans have always been taking for decades in terms of helping the countries where there's a big crisis. There are much more physicians in Cuba. And when there is a big crisis, then the Cuban government put these medical personnel at the disposal of countries where there is a crisis. This has been the case in West Africa, for example, during Ebola. So this is something which is quite well known. It is very useful for the countries under stress, of course, and somewhere it helps also increase the prestige of Cuba in the health, in the world, as a country who knows not only how to manage health, but also how to help others. This is one of the examples that I could think of. Now, health diplomacy is also used in other contexts, for example. It is known, and I worked a lot in WHO in the area of access to medicines, and lots of discussion about what countries should do, and in particular high-income countries, in terms of investing into research and development for health for the countries with less means, for low-income countries. And there were a lot of discussion to know whether this help, into this financial support for research for a low and middle income country could be pooled, whether it could be a pooled fund managed by WHO or others to finance a project that would, as a consensus basis, be thought to be the most valuable. And actually, when you look at it, although many people and governments say, yes, it's a good idea, but it never happens, because although some countries invest much more than what is mandated, I must say, in all the discussion and resolution to health research for the benefit of low and middle income country, most of the time they want to remain free of using these resources, because they are used also for health diplomacy. Not only do they serve a purpose of boosting R&D for health for poor countries, but they are also, this money is also helped to push the diplomacy and the overall diplomacy of these countries. So this is something that I see is quite usual. Now, to what can we compare what we see in COVID-19? I was reflecting about the commonality and the differences with what we saw in terms of diplomacy during the H1N1 influenza pandemic. So both pandemics started about the same. At the beginning, we don't quite know. The flu pandemic was started in Mexico. At the beginning, the concept was the mortality was very high, which at the end wasn't the case. So the same fear started. You know, should we stop international travel? Should we close borders? Also the blaming game. You know, how could this happen? What's the cause? And of course, it's not me, so it must be my neighbor if I have cases in my country. So when there was started also to be all the discussion about vaccines, nobody, you look at, especially in Europe, nobody wants a vaccine when there's not a crisis. I exaggerate, but the vaccine hesitancy is very high. But as soon as you have an emergency, everybody says, where's the vaccine? I was a vaccine, I want it now. So it was the same with H1N1, and everybody wanted vaccines. And this is the time when we realized that there was none to be purchased because everything had been sold. And this is where health diplomacy kicked in. You know, we are in a global society. It's not possible that only the very high income country get the money to get the vaccine and the others get nothing. So then started discussion with manufacturers, you know, to get them, when I was at WHO at that time, to have them agree that they would donate for poor countries 10% of their real-time output. And also with the countries who had purchased vaccine to say, you know, will you donate 10% of what you have purchased for yourself for poor countries? And this worked. But also where we see the difference, I think, is that quite reasonably quickly, the scare for the H1N1 influenza pandemic decreased. And this made all this donation discussion much more fluid. But we are not there yet for COVID-19, and the anxiety is still high. And therefore, we don't see yet this fluidity in terms of health diplomacy.
Thank you very much. And I think that's a little bit the feeling that we ordinary people have also when looking into, you know, the news and what is happening and what the actual collaboration at the international level is at this point. We do see some very good advances. For example, here in UNESCO, we work on open science, and we've seen a very nice push for open science, open access to international journals, to information, data around COVID-19 and the virus itself. So that was a pretty positive step forward. But then at the same time, we see that, as you said, maybe the timing is not ripe yet for a more fluid conversation between countries without this high level of anxiety and this feeling of, oh, okay, I'm going to get something for me first, and then I will take care of somebody else. Just one question: you've raised the question of you know, these discussions around pooled funds or a common funding. I think this is something, and I'll get back to the other speakers about that, and I see that in the chat as well. These pooled funds or international regional funds, do they exist? Do they work? Is it something that should be promoted more? Is it something that is at the basis of health diplomacy, or is it the result of health diplomacy? I will start with you, MARIE-PAULE.
Thanks a lot. Just to come back to what you had said about open science, and this is certainly something where we see an absolute difference with what we've seen before. Mm-hmm. This comes actually when I still was at WHO. During the time of the big epidemic of Ebola in 2014 to 16, we started to work on that, and the major journals agreed that scientists could make public their discovery for the public health in order to mount the best response prior to publication, and they could still publish their articles in the big journals. So this happened very well in this pandemic, because there was a lot of preparation also, because the discussion started in 2015 around Ebola, in progress, there was agreement, and now there is a sentiment that this is what needs to be done. So of course, you know, too much information without peer review and the voice of science is a little bit mixed these days. But we can see, for example, that through notably the help of an organization called DJOUDALBAYE, which has long before and has been collecting influenza virus sequences, they immediately came and opened a room, if I may say, to collect sequences for COVID, for SARS-CoV-2. And now they have just passed 10,000 sequences. So sequences are shared readily. And the beauty of this aid is that it has a provision that if a scientist or a country deposits a sequence, he or she doesn't lose ownership. Therefore, open science is really, empowered. Now, what was your question? Sorry, I got into open science and
I'm happy.
I got lost. My apologies.
So hard on open science these days. It's great to see that there is enthusiasm around it. It was about the funds. Oh
yes, the funds. So we, of course, traditionally development banks have funds which is pooled, and the World Bank also can, through multinational input of finances, take into consideration funding of project at a global level. This has been existing. Now, what we see, what is new, I would say, is the pooling of funds that results from an initiative called Act A, which has been, I would say, advocated by the French President, Emmanuel Macron, but was put in motion by the President of the European Commission to bring everybody on board and to have them pledge money to support development and of diagnostics of drugs and of vaccine to help reach equity in terms of access to these medical countermeasures. So through this initiative, there's been quite a number of billions of dollars of euro which have been pledged, although I understand that it's sometimes difficult to change a pledge into an actual amount of money which is available. But certainly the pledging of this money has empowered then the creation of at least of a vaccine pillar of Act A called COVAX, where I think currently more than $3 billion US have been pooled in order to allow purchase of vaccine for low and middle income countries. So it is happening, but still not that often, because still I would go back to what I said at the beginning. Money used for development assistance and for health is often regarded as a diplomatic tool, as a way how countries practice health diplomacy, and so it's difficult to give away, how would I say, independence and sovereignty.
Great, thank you. Thank you very much for these thoughts. Professor CHATURVEDI, from your point of view, health diplomacy, COVID-19, in your particular context, what are some of the key messages that you would like to share with us?
I think thanks Anna at the outset for giving me this opportunity and for bringing in RIS in InsSciDE project for discussing some of these important issues. I think when we talk about health diplomacy, to my mind, 4 features are extremely important as they are unfolding the content and also the sort of focus that is needed in health diplomacy. And I fully agree with Benjamin when he says that the multiplicity of factors has provided the new vibrance to the whole issue of health diplomacy. The 4 points that I feel that are important, one is, of course, Dr. KIENY is right that the interdependence has come out very, very sharply. And I think, Anna, you also made this point in the beginning that we are interlinked and the destinies are woven together. So even if we are putting this blame game, as Dr. KIENY was referring to, I think it is important that we realize this, and global cooperation for international interdependence, I think, has come out very clearly. So health diplomacy delivering the global policy dimension, I think, is absolutely clear. That's the first point. Second, and your question was about the regional funds. Are they helping? Are they? The second point is about the regional initiatives and regional cooperation. Regional initiatives may range from setting up of the fund to several other features. And I would come back to that a little later. The third part, which is extremely important, is the cooperation for health infrastructure. Hitherto, health diplomacy was largely in terms of sending medical professionals or sending the medicines. So India has been the capital for generics. So we have been sending generics all across to all different countries. The other gadgets that are required, the ventilators, etc., the PPE, etc. But now we are realizing that health infrastructure also is something where very specific attention is required in terms of international cooperation. And this is when cross migrations are huge. People from one country are into other. And in the last 10 years or so, the global debates on migration have been so intense that now the time has come to see how the health infrastructure is built up so that there are less vulnerabilities across the border. So how cross-border cooperation for health infrastructure is strengthened. That's the third point that I wanted to make. The fourth is about the capacity building. Capacity building not only of the medical professionals that are needed, but also the primary health workers, the customs and many other agencies that also have to bear the brunt of being the front desk, the whole challenge that they have to face. And the pandemic's experience was such that it was cross-cutting all different sectors. So inter-sectoral linkages are also extremely important. As you might have seen during last 6 months, the trade almost completely collapsed. The livelihood security has collapsed. And in countries like India, where urbanization has happened at a much faster pace, the reverse migration of people who came from specific rural areas, they have gone back. And this has happened in several countries when it comes to neighboring countries where they were working and have come back. And as a result, these spillover effects are there. So how the health diplomacy can address some of the economic challenges, how health diplomacy can address infrastructure deficit, and how it can effectively address the regional cooperation priorities that are there, and of course the global level cooperation. Within global level cooperation, I would say that 4 tracks are extremely important there. We have discussed the vaccines and vaccine-related global initiatives. But second, and I think much more important, is the institutional architecture that we require at the global level. Putting all blame to WHO is one part of the whole exercise, but I think we require much more efforts in terms of how the shock-absorbing ability of the global institutional resilience that we need, I think is important. And that's where probably we can do, like, for instance, there is now greater demand, and as Dr. KIENY very rightly said, that we need vaccine now. We actually need it, just give it. So that kind of delivery which is needed actually requires a huge coordination for production, because we have very limited global production and we require it to be mass produced. Only 8 billion doses you can produce. So you require much more effort. And for that kind of coordination, you require global standards to be fixed up. So my third point is, apart from resilient institutional architecture, you require global standards in terms of how mass coordination and production of vaccines is to be done. So how global network of laboratories come up, which is there. WHO has contributed immensely in terms of that, but we need to do it in a manner that can deliver demands like what is coming in. And the fourth and the last point there at the global level is in terms of the trials that are happening, the clinical trials for the vaccine that are happening. How global coordination is possible. As of now, there is a race, there is market, and there is a commercial incentive also, but there is also, as you rightly said, open sourcing. And I think if we go on that track and see that there are enough incentives available, then what kind of delicate balancing we have to offer when there is a public policy objective and there is a commercial demand. How do you balance that? So there are some solutions like Health Impact Fund and others that are important. So at global level, what kind of policy choices we can make that Thomas Pogge and many others have been talking about in terms of the Health Impact Fund. So that kind of, I think, balancing is important. And that also brings me to the sub point there of the burden of the intellectual property that comes in along with that. And there you very rightly said that open innovation is the solution. So I think these 4 points within that broad global architecture we need to address.
Yes, thank you. Thank you very much. And also for yes, structuring the discussion, because it's also true that now we see it very much with this particular crisis, really about these interlinkages. And health diplomacy is not just health diplomacy. Already diplomacy, as Dr. KIENY was saying, it's a tool, right? So there is the health diplomacy, but it's connected to other types of diplomacy. So there is that, and then there is the fact that it's connected to so many other different sectors. And actually, the first speaker, Dr. DJOUDALBAYE, you were talking about this, you know, different actors in different sectors, and the question is, you said that there are conversations between the different actors. Those conversations are happening at what is kind of the best scale to have these conversations? Is it at the national level, regional, international, and how do we build bridges between the different scales that are needed? So not just among the health community in the context of health diplomacy, but also more broadly. We're talking about trade, we were talking about education, science. There is so many different, you know, actors in the game. You even mentioned, of course, the faith of organizations. How do we work across all of these actors and then across scales? Are there any good examples that you may share with us also?
Oh, sure. There are many examples that I can share, especially on what is happening on the African continent. And yes, we have different actors, and actors are from national level to the continental level and even to the global level. And we need to work and have what we call in French passerelles, you know, among all of them, so that the message can pass through. I can give you a concrete example on the COVID. You know, when COVID-19 started in Africa in February, when Egypt has only 1 case, and this was on the 14th of February, you know, on the 22nd of February, the continent, the African, the continent, gathered together here in Addis Ababa to have the first ministerial meeting on COVID-19. So during that meeting, what we have done is to have a joint continental strategy, you know, to fight COVID. That is one. And all the ministers of health across the continent were here on the 22nd. So what this ministerial did, 2 things: the continental strategy with 3 pillars. The first pillar is to prevent infections. The second pillar is to prevent death. And the third pillar is to prevent social harms. And I will come to that one, to each of them. Then the second thing that the ministerial meeting did is to establish a African continental task force on coronavirus. And this continental task force goes from the head of state and government up to the country levels. So we integrated also the regional economic blocks into that platform. And that task force has as what we call a steering committee. And in that steering committee, you have all the institutions, like WHO is there, you know, World Food Programs. We have many other institutions that are working with us in that in the steering committee. And the head of state went ahead to establish the ministerial coordination committees. Given the challenge that we were having with all the borders closed and all those kind of, they established one coordination committee of the ministers of transport and logistics to ensure that corridors are open for the goods to move and for these supplies, the medical supplies, to move to different countries and regions on the continent. Secondly, what they did is to also establish another coordination committee of the ministers of finance on the continent to mobilize resources. The third one is the coordination committee of the ministers of health, and that committee brings also all the regional economic communities and other institutions that are working on health on the continent. So everybody, this thing integrated. Now, on the financial part, they went ahead and they established a fund. And I am actually the executive secretary of the AU COVID Response Fund. Okay? And the fund aims to raise resources to strengthen the continental response to COVID by supporting the full procurement of diagnostics and other medical commodities and supplies for the continent. And we went ahead to establish the Africa Medical Supplies Platform. We brought all the suppliers across the world into that platform. And those who have already, you know, the WHO accreditations, the FDA, etc., they are all there. And in a negotiated rate already. So the member state can go directly to procure. And there is an intermediary, there is a bank, the Afrexim Bank. The Afrexim Bank also is the one paying directly. And there is a pre-arrangement with the country. So when a country wants an item, for instance, they say, okay, we want this Afrexim Bank paid, and then there is a negotiation, an arrangement between the country and Afrexim Bank. And all this kind of been put together because of the health diplomacy that we are exercising on the continent. Otherwise, it would have been extremely difficult. And I can also mention a second initiative called Saving Lives and Saving Economies campaign to protect borders, economies and the schools from COVID-19. And we brought two sectoral ministries, all the ministers of transport on the continent and all the ministers of health on the continent. And they discussed the harmonized approaches, processes, and tools in order to protect borders, economies, and schools, as I mentioned, in partnership with the private sector. And they did also the risk assessment and management of this COVID. All that one to minimize the spread of the infection within and across the borders by creating public health safe corridors and safe travel through harmonized COVID testing certification for land, sea, air border crossings in Africa. And we are going to extend that one to our European partners, our Asian partners, and our American partners also. So that, and we are using also the e-health networks, using digital applications for contact tracing of travelers. You know, mutual recognition of cross-border information exchange for enhanced surveillance. So all those are the things that we are putting in place. And this application will be officially launched on the 1st of October. So we know that this COVID pandemic has relied on quarantine or quarantine-like measures that amount to large scale of travel restrictions, lockdowns, stay at home, isolations, travel bans, etc., even including physical distancing and social gathering were limited. everywhere. So we don't know, maybe we will have more sophisticated health measures and between borders that could be introduced on a widespread spread basis, especially that Europe is going back to a second wave. And we are really looking at Europe very closely because most of our first cases came from Europe. So we are looking at that one, and the collaboration with European CDC in that area is very, very, very strong. And these include health measures applied to planes and other cross-border transportations, responsible for travel, behavioral, education, all those kind of things, at entry and exit screenings, all those kind of things we are looking at them. So we know that this growing number of health challenges now transcend national borders, and this generates demand for more concerted policy response, as well as diplomatic coordination at the global level. Now, if you do all these kind of things to answer to your question at country level, at the regional level, at continental level, now you need to take it up at the global level. And like at the national level, where a country responds to a set of health conditions via its national health system, at the global level, what is required is an understanding of these health conditions in the context of cross-border transfer of health risks. That needs to be understood very well, because some countries are they maximize the protection, and we are operating in an interconnected world, highly interconnected world. Nobody can, live in isolation today. A COVID-19 risk anywhere is a COVID-19 risk everywhere. So we have to be very, very, very careful. And the relevance of and heightened importance is that accorded by the International Committee toward the health diplomacy results. From the impact, it has won 3 major aspects on the global agenda. I think, to my point of view, on the world economy, on the security environment, and the humanitarian, as well as the human rights and social justice arena. So these are the things that we need to look at closely, especially in the global arena. So let me stop there. Thank you.
This is excellent. Thank you very much. And it's really good to hear, these concrete mechanisms that are put in place in Africa, and more people really are looking into the African response to COVID-19, because it seems to be working. And one of the reasons why it seems to be working is because of this coordination. Just very quick question, just follow up. Is it because you have had in the continent recent outbreaks of Ebola cases, for example, and that has put in place some of these mechanisms upon which now you can kind of go back to? Is that one of the reasons why it seems like these are good mechanisms that are put in place, mechanisms that are working and to be shared with the other regions as well? So did that help in a way?
Two things happen really, and that has helped the continent in this current response, and maybe it went unnoticed by the rest of the world. We experienced, the Ebola outbreak in West Africa.
Yeah.
But before the Ebola outbreak, in 2013, the head of state and government of this continent, they gathered in Abuja, and they have decided to establish the Africa Centers for Disease Control and Prevention. This was a few months before, the first case of Ebola in 2014 in Guinea. Okay. And while we were establishing the Africa Centers for Disease Control, we had to go and respond to the Ebola outbreak. So we fast-tracked the establishment of the Africa Centers for Disease Control. And Africa Centers for Disease Control has a mandate to safeguard the health of the continent. And we have a 5-year strategic plan going from 2017 to 2021 with different pillars, including, and the preparedness and the response was one of the most, let's say, important pillar including the lab capacity. So you cannot do preparedness and response, including surveillance, disease surveillance, without a good lab system. So what we have done, we have the establishment of the Africa CDC. And when Africa CDC was officially launched in 2017, we went to quickly to establish what we call the RISNet, the Regional Integrated Surveillance and Lab Networks across the continent. So each region, we have established, these things. So experts of the different regions of the continent were starting knowing each other, talking to each other, and they started having what we call the Zoom calls then every week to discuss the cross-border issues, or what have you, in terms of surveillance, what are the new events that you are seeing. And we have here in Addis Ababa a continental emergency operating center, which we are doing event surveillance, event-based surveillance on the continent every morning. We are looking at all the events, we confirm these events with the member states, and we move forward. So we were alert, one. That is the establishment of Africa CDC. The second thing that happened is just that after the Ebola outbreak in West Africa, WHO embarked on the joint external evaluations. Mm-hmm. And they evaluated the core capacities of the international health regulations for each member state. Most of the African countries went through that process. And Africa was paint red. Africa was paint red, not that we were not ready, we will not be able to. So we were aware of our challenges. So we said, let's get prepared, and we were starting conducting the simulation exercises, the tabletop exercises across the continent, So that helps a lot in this current COVID-19 response. That is what the world doesn't know, We have started, we were conscious of our challenges, and we have started, putting all these measures gradually, in place. It is not something else. And because now countries are trusting each other, and they are collaborating, they are working each other together. Because before then, the continent was really divided. Now I am Francophone, I am Anglophone, I am Lusophone. The people don't know each other, Even if they are sharing the borders, they don't talk to each other. They don't know each other, Or when they were doing it, it was in a very limited square. But today, any single expert everywhere in this continent can pick a phone and call in everywhere if there is any event to verify. And they will put the things. And they will learn from the others. What have you done when you were facing this thing? So that they can adjust or readjust themselves very quickly before facing the situation. And that has helped a lot, Africa. And we are seeing it now. But we are not yet there. There is a lot to do. And in 2017, toward the end of 2017, 2018, the director of Africa Centers for Disease Control and myself, we published the new public health order on the Lancet Global Health. And when you go back to that one, our vision for the public health and how to safeguard the health of this continent is well defined and well written there. So that is exactly what we are following. So we have the concept in place, we have the ideas, and now we are looking at the means just to put everything that we have planned in place. Thank you.
This is really interesting, and I think it also, talks to the fact that health diplomacy happens also in between crises, right? That's the moment where you have to get ready, prepared. These evaluations from WHO, the strategies, sometimes we don't see, it seems like it's another, administrative exercise, but actually it really does help to prepare the countries once they actually need it when a crisis actually happens. So great to hear from the continent how things have been put in place. And as you say, there is much more to be done, but we learn as we go, and it's great to see these advances at this point. One question for MARIE-PAULE, and I saw that you have already responded it in the Q&A, but I think it's important maybe for the discussion. It's about the role of civil society. the initiative that we heard about now is more kind of top down, which is fine, and it has to be the responsibility of different governments, ministries, etc. But what is this role of the role of civil society, and how does civil society interjects in health diplomacy globally, and in this particular case of COVID-19 in particular?
Well, thanks for the question. You know, like Benjamin, I take a lot of inspiration from what we learned during the big Ebola crisis in West Africa. You know, at the beginning, the responders, including at WHO, thought, you know, Ebola, one more epidemic of Ebola. We know how to do it. We come, we have a cowboy hat, not all of them, you know, but just for the imagination. We parachute there, we isolate people, and very soon it will be over. Don't worry, it's all fine. But then actually it didn't work like that. It didn't work because by the time it was known that the epidemic was there, it had already infiltrated slums and in the 3 major countries. And the civil society, the people actually resented the arrival of these mostly white men coming to take their dead people, to bury them outside of any traditional practice, to take their family when they were ill, to put them in treatment center where most of the time they didn't come alive. So there was a lot of violence and resentment, and cars were stoned, health workers were killed, and then when really the international, you know, crowd, if I may say, the ones responsible for, realized that this was there to stay longer, then this was a start of recognition that that civil society and people actually were important in the response. So this is where a lot of efforts was made also in investing more into social sciences to understand actually the values that came this concept of dignified burials, safe and dignified burials where people, you know, could reconciliate, you know, the need to avoid contamination with Ebola, and at the same time to bury their relatives in the way that was respectful for them. And there was a lot then of initiative in the population, in the community, which made finally that the epidemic receded. So this showed, in my opinion, that in order to win an epidemic or a pandemic, you need to play with the community, with the people, and you can't play against them. They need to accept what you want to do, otherwise they won't follow. You know, when I see a number of measures which have been implemented in Europe, for example, of course, you know, they make a lot of sense, wearing masks, and but if the population doesn't actually agree, doesn't take it on, doesn't think it's important, it's implemented only partially, and then it's not very effective, and then you have to put another layer of measures and more restriction. So I think that it shows how important it is to bring the population, to bring civil society on board.
Absolutely, I would agree. Yes, definitely, and I'm not sure to what extent we are actually doing it right now in the context of this crisis. But it's always easier to go back and see how things have been done rather than, you know, applying some of these things as we go along. Yeah, we might have to wait a little bit longer for some of these measures with the communities to happen in the context of the
but you know, if I may, first, it's true that we are always more clever after the fact. Okay, and of course we would all have seen the pandemic coming if we had known what we know now. Okay, of course, you know, if we'd known that they were asymptomatic, who could transmit the disease, we would have you know, had masks before, and so on and so on. So it's always I think it's bad practice to judge the past with the knowledge that we have now. But for example, in terms of civil society, I'd like, for example, what we see is that with the rush for the development of vaccine, which is understandable, I think there's no doubt about that, but the more the population, the people see this politicized, see this as a battle for the re-election of a particular president, and the less confidence they will have. Nobody asks them, what you want from a vaccine, and it's rush, let's make vaccines and let's inject it into people. It won't work. It won't work if people don't want to take the vaccine. It won't work with if people are afraid because they think that this has only political incentives. So we need to go back to this understanding that we need to bring the population on board, and that it's better maybe to go a little bit more slowly than to have the population adhere to what you want to do, rather than to rush and have the population actually fly away.
Mm-hmm.
Can I share something on that one quickly?
Please do.
Yes, just to share a concrete example, what is happening here at our level in terms of working with the civil society and all these organizations. There is nothing we do without the civil society involvement. That is our principle, and it is there, and they participate into equal basis with the member state. There is no, I am a state or actor, I am a non-state actor. No, when we bring them to our forums, they are participating in equal basis. Their voice counts. That is very important. And concretely for the COVID-19 response, we have one system that we have put in place is the rumor tracking system. And the rumor tracking system, we track the rumors across the continent on the COVID. And how do we respond? We are using the civil society to respond to these rumors in the country because we are not present everywhere. So they are our relays in the country. So now when we identify a rumor and we in a particular country, and we know that this civil society is operating in the country, they are our partners and they are in the communities. So we together, we define the countermeasures or the message to counter, this rumor. And the partner that is implementing it in the field is the civil society organization. And we are doing it a lot. And we have, on top of that one, what we call the last mile communication. The last mile communication. And this last mile communication also is being implemented in different African languages, these major African languages. So it can be in Yoruba or in Hausa or in Lingala, in Kiswahili, or whatever language. So then these who are relaying these messages in the country are the civil society, using TVs, community radios, and even door-to-door campaigns. And these who are working on that one are the civil societies. So we at the continental level, this is how we cascade our message down to the ordinary citizen of the continent. Thank you.
Thank you very much.
And if I may interject also, what you said, Benjamin, is very true, but actually radio and television go only that far. If you want to go this last mile, it's actually person-to-person discussion, because many of the people don't have a radio or don't listen to the TV. And so you need to engage with the civil society at the grassroots level. And this is absolutely important. But I think the advantage that you have in Africa for that is that the civil society is more organized, if I may say. In Europe, we've lost it quite a lot because people have moved out, are moving in different countries, out of their city, out of their family. So it's a bit more difficult to recreate, the civil society that you have in Africa or in India, where people are there to stick together because they are their family, if I may say also. And but all these structures need to be used. I remember when, again in Guinea, when we were implemented the clinical trial of Ebola Ça Suffit vaccine trial, we were going in the staff, not I, was going in very remote villages, and all the communication was only oral. We didn't use TV, radio, leaflets, all oral, talking to people, talking to the elderly, to the wise person in villages. And at one point during the vaccination period, Ramadan came. And of course, the fear was that you can't do vaccination during Ramadan. But then with discussion with the imam and the religious leader, there was a statement saying that vaccination was halal. And this allowed vaccination to continue. But it's only thanks to engagement with community leaders and with civil society that actually this was possible. And I think that we don't use enough these conduit in high-income countries.
Thank you very much for that. And that brings me to my question to Professor CHATURVEDI, also a little bit in this context, and going back to health diplomacy in this digital era. So where you have a lot of information circulating, where a part of population understands, the other one doesn't. How do we work with that? How do we promote health diplomacy in a digital era, knowing that it gives you a lot of good opportunities and good outreach, but also may not be enough, or may actually pose some challenges?
Thank you. Thanks, Anna. I think before I respond to that, let me just add a bit on what Benjamin and Dr. KIENY came up with in terms of the role of civil society. And I think it is absolutely essential. At RIS, we had 2 projects under FP7 when we discussed issues related to under reward and responsible research and innovation. When we discussed the trust in the regulatory architecture, and that I think is absolutely essential for population to have, irrespective of how much awareness you bring in, unless people have faith in the kind of solution or engagement that you are offering, I think nothing can help. So the idea that the solution would have the ability to be inclusive in its solution, the idea that it would be trust building, would get the equity within the society with the solution, and also that it would ensure access. So under that project, we had developed an AEI framework, access, equity, and inclusion framework, to make it a point that people's trust in the regulatory architecture is important, and the solutions would have an appeal to people if they are sort of facilitating access, equity, and inclusion. So that I think is important. On your question of a digital component in the health diplomacy, I must give you India's own experience and how our preparedness in last 4 years, even in terms of moving the economy forward, has been a great support in the times of lockdown and in times of this major crisis that we are facing. If you look at the digitalization within the health sector and its connect with the economy, I think it's amazing. If you look at the current economic challenge that the health pandemic has placed before the developing countries, you find that the challenges are at multiple levels. So digitalization within the economy is of great help, particularly I would say for developing countries, and I can certainly say for India, that we could reduce the direct benefit transfers, the leakages that are there. And I think it's a problem with the South, with the developing countries where corruptions are huge and leakages are huge. People cut corners in terms of even supply on very, very critical health support mechanisms. So as I said in the beginning, health diplomacy in times of post-pandemic would be extremely important to build the relevant health infrastructure. And digital component is extremely important in this overall architecture of the health infrastructure. As I said, we could transfer the direct benefit to people, the targeted beneficiaries. We could keep the records, and we could encourage telemedicine across, something that that was not leveraged in India so much all this while. And telemedicine has got a new traction, completely new traction. So the digitization has helped, the records have helped, and as I said, the infrastructure has benefited in terms of how this can also be done. The fact that the pandemic came with the lockdowns, and as a result, the whole economic activities have gone haywire at the global level. We are having the dangers of collapse of the financial architecture. The banks are facing the huge non-picking up of the credit. We are seeing the slowing down of the manufacturing sector. Agriculture sector is the only savior in most of the developing countries. And agriculture sector is providing the necessary pollen, but the digital component can also address the nutritional security that is required. So health diplomacy part is something which is important in terms of developing a resilient digital infrastructure that would support coping up of the health sector challenges across the countries. And digitalization also helps in terms of how the infrastructure overall deficit that most of the developing countries have. And that's where the North and South have some sort of different sort of playing grounds that they can really do that. The fact that India's National Immunological Institute, the NII, and the Virology Institute, they could deliver on the vaccines that are now in place is largely because we could focus on the digital infrastructure. So when vaccine research is being done and its mass production is being explored, the idea of digital infrastructure would be very crucial and very important component in this whole architecture that we are talking about. The other use of digital is in terms of, like for in India, what they did was to use it in mobile. Now, a huge population of India is using mobile. Now, you can't dial a number in India, or you can't receive a phone in India till you hear a message from the National Health Authority on what care you need to take on COVID-19. It's a simple message, but it has become a caller tune in most of the networks that you subscribe. So simple messaging, simple texting is also helping people to save them from n number of rumors that are there, and their leveraging of digital media of the Facebook or of n number of things. Because what happened was that people started spreading wrong news about COVID deaths. Those who were not dying, they were also being reported, and in fact, wrong claims were being made on the insurance agencies. So government came down heavily in terms of regulation of the WhatsApp group, the Facebook uploads, the text messages that are going in, and even to some of the digital media, government came out with regulations. So I think that was quite helpful, and this would play an extremely important role when we talk about health diplomacy. And I think we would fail in our factoring in of the larger science diplomacy dimension within the health diplomacy, because that's where the larger question of engaging and equipping the partner countries in terms of providing the solutions that are coming out of our national experiences to regional benefit, and see that the migration or the other issues that are emerging in different regions are adequately addressed. Thank you.
Excellent. Thank you. Thank you very much. It's a lot of very good information, and again, we see the connection between all the different aspects of the society that we live in, which is quite a complex one, but also a pretty exciting one at the same time. I see a very interesting chat discussions also, and thank you for our participants for posting in the chat, in the questions. I think we have a little bit of time now if the participants actually want to ask some questions. That is possible. I'm not sure. I think, Daniela, you can tell me if the participants can raise their hands, or do they just post their questions in the chat?
We're using the chat function for
The chat
questions.
function. Okay, so if there is any additional questions that the participants would like to ask, now is the time. And if I don't see any questions, I actually have one that has been posed in advance to the meeting, which I find kind of interesting. And maybe I will, you know, get our speakers a little bit out of their comfort zone, because the question is, how can we apply some of the lessons learned from health diplomacy in this particular case, or in general, on some of the other science-related diplomacy issues, such as climate change? So what are some of the things, lessons learned from health diplomacy that maybe we can apply to other types of science diplomacy-related issues? Any ideas from our speakers? Yes, please.
Thank you. Thanks, Anna. I think one straightaway lesson that I can think of that probably would be extremely helpful would be to have the adequate information exchange across countries. The fact that we talk on the basis of evidence is something that gets translated immediately in terms of people's response and also response of the governments. And that probably is the lesson that this pandemic has offered, that we need robust exchange of information, of the details that are actually causing challenges that are evident all across. And in fact, if you see in the Pacific, whether you talk of Palau or Nauru or Antigua and Barbados, in Guyana, you find that the evidences of the climate change for the small island countries particularly are evident, and the rejections are not going to help. So instead of taking a macro picture and getting into the data, the micro details are very evident. Maldives, for instance. So first and foremost is a rigorous micro level data that is coming out of experiences at different locations. That's number one. And number two, I think in terms of the science part of it, which is all the more interesting, is in terms of the solutions that we are thinking of. And as Dr. KIENY rightly pointed out, it requires people's faith of course correction that is needed in terms of how we can reduce the carbon footprint. And that probably is something that can take us forward. So these two lessons are straight away coming out to us, and I think they have implications not only for climate change, but for some of us who are students of science policy, innovation policy. For us, it is of great significance what part of it goes to science policy and what part of it goes to science diplomacy is something that can be explored. But I think what is more important is to see what lessons are actually coming out for the whole spectrum of things that we are dealing with.
Much. I agree with you. It's a couple of things that have come up very strongly from this situation in the diplomacy world in general that can be applied definitely for some other issues. We have one question about I hardly hear Africans discussing science diplomacy. What is the cause? I will go to Dr. Benjamin first, and then other speakers.
I don't think Africans rarely discuss science diplomacy. They do discuss. Sorry?
Maybe they don't call it science diplomacy, as you were saying.
Maybe, yeah, exactly. That is exactly what I wanted to say. Maybe they don't call it science diplomacy. And, you know, we have a problem on the continent. Lot of good things are happening on the continent, but it is just not known outside the continent. And when we are talking about this open source, those open source resources, we need to be more and more involved into that one, so that many things that we are doing on the continent is also known outside the continent. That is the challenge. I think it is about the information sharing, and it is about, you know, maybe they don't call it science diplomacy. Oh.
No, I agree. Professor Chaturvedi, did you want to say something? Please.
Yeah, I wanted to say that we have recently launched a mega project with Kenya, Ethiopia, Ghana, in terms of how STI can help achieve SDGs. So STI for SDGs is something that we have been working on. And there, the idea is to see what Japan and EU can do. India is also a pilot country. Serbia is a pilot country, to see how science, technology, innovation can be leveraged for achieving SDGs. And there I see the National Science Technology Agency of Kenya and Ethiopia both working very closely. I mean, we can very well describe that as science diplomacy, but they don't use the word science diplomacy. So I agree with Benjamin that they don't use it, but not that they're not doing it. They're very much doing it. And in fact, ACTS Kenya, the 5-country center, the African Center for Technology Studies, ACTS Kenya, is something that is actually promoting adoption of science technology for various SDG goals.
Thank you very much, and thank you for raising the STI for SDGs project. We at UNESCO are very happy. We are working with Ghana in promoting them their STI for SDGs roadmaps, and as you say, it's a very interesting exercise, and it is a science diplomacy exercise. Again, at different levels. Sometimes, as we say, we do diplomacy without necessarily calling it like that. I'm looking again at the chat. I don't see any new questions.
If I may add on science diplomacy in Africa, I think that Africa is engaged clearly in science diplomacy, and there are collaboration across blocks, economic blocks. But I think that, you know, maybe the pandemic might have actually help in this in the future, because as we all know, across Africa, international travel is a nightmare, you know, and to go from one country to another. Sometimes you have to go either through Europe or through Addis, or, you know, and therefore there's a certain isolation. But now we are all used of doing Zoom and Teams and whatsoever, and actually traveling in person is not that important anymore. So this may also help movement on this health diplomacy on the continent. Would it be for health? Would it be for science? And this might be an unexpected positive outcome of a pandemic. I don't know if Benjamin or Sachin are in agreement with that.
No, I totally agree with you. I totally agree with you. And we have the AU Development NEPAD agency, which is working a lot on science and technology and innovation as well. And at the commission level here also, we have a department of science and technology. So I think it is just that people don't call it science diplomacy, but there is a lot of work that is going on this area. Thank you.
Just one question for Professor Chaturvedi in the chat. How do you reconcile values across developing countries? Yes, please.
I was just reading that when Dr. KIENY was making her point. I think the value systems do require different kind of sort of approaches to be reconciled. And I will give you an example of India working with Bangladesh and Sri Lanka on some forestry related projects, and the value systems that the Ministry of Environment and Forests of India and their counterpart had so different kind of approaches in terms of what can be planted in a forest and how the ecosystem should actually work. And the differences led to so many conflicting positions that eventually the government stepped out and gave it to a civil society organization to deliver it. And in both Sri Lanka and in Bangladesh, we found that when they also gave it to their social forestry CSOs, the value systems converged very well in terms of how the local population was seeing some of these. Like, for instance, in certain forests in Sri Lanka, they do not allow rubber plants to be taken into the forests which are of tropical importance. And this civil society could do it, and fortunately we were part of the exercise. It became quite easier in terms of how that goes further in terms of addressing the different value systems. So at times, definitely, it requires leaving the position and taking another pedestal to see how the point is communicated. And science technology that way requires very flexible approach. And as I said in the beginning, under FP7, there was an interesting project in Reward when we worked on responsible research and innovation to see how it brings in access, equity, and inclusion. So people should have that sense of inclusion. They should not have the ideas that they won't have access to it, or they would be excluded from that. So I think that effort can really bring in flexibility in science diplomacy, or for that matter, in the health diplomacy.
Very good. Thank you. Thank you very much. Thank you very much for that. I have one more question for Benjamin, but actually I think MARIE-PAULE could also respond to that. Considering like Africa CDC and partners have managed to foster synergies across the continent, what kind of initiatives should be done based on that on a larger scale? Is it possible to achieve something similar on a global level?
Yeah,
Well,
thank you. So,
oh, sorry, Benjamin, do you want to go? Because he said I could also answer. Start, and I'll give a word.
Go ahead.
You know, I
Ladies
think
first.
it's already excellent to see this happening at the level of Africa. And actually, Europe, as you know, is struggling to do this also together. What I see, you know, is that the discussion, coming back to COVID, the discussion about access to vaccine and purchase of vaccine is inclusive now at the level of the European Union. There's a lot of discussion, of course, with global level, with COVAX and all that, but there is a group working together, and therefore there is no secrecy anymore on vaccine within this group. You know, the industry cannot come and tell one country, well, you know, you have a best price, but this is secret, don't tell anybody, and go to another one, I give you the best price, and so on and so forth, because among the 27, everybody has the same information and they know, and it is transparent. I hope that this will also happen at the level of the African continent, because some of these countries will also have to purchase themselves a vaccine that they will use. And so we can start with these communities to increase regional health diplomacy and get success, and then of course link these blocks together to come to a true global health diplomacy. But Benjamin, I'll stop here, please. Apologies for having interjected.
No. I was just saying that no, it was a pleasure to allow ladies to speak first, and there is no problem for that. No, I was just saying that what is happening, for instance, for the vaccine access, we are part of the COVAX, so that is a very good test for the entire world to see the health diplomacy at work. That is number one. And at the continental level here also, we have our vaccine access initiative for the COVID-19, and we have the strategy. We convened a meeting in May ending or early June, with more than 3,000 participants across the world on the vaccine initiative for Africa, also the COVID vaccine. So this is something that is at work. If Africa is doing it, we have a kind of pilot study already in place. So it is just, we need to duplicate it at the global level. And if we were able to do it You know, and if you take the Africa with its heterogeneity, and if we were able to bring everybody under one roof and coordinate and collaborate, it is possible to do it at a global level. But we need to have the will to do it together. Thank you.
Thank you. Thank you very much. Professor CHATURVEDI, since we are kind of towards the end of our discussion, and I think this is a nice question to for everybody to respond. Anything from your side, an additional comment before we close the session?
I think one thing that is now to be done post-pandemic is not to forget the lessons that we have learned, and it so happens that life then becomes normal and we just move on till another crisis strikes us. The specific national or international agencies may come up with some things that are different, but probably we require a step backward and see how we can really absorb the new lessons that have come in. And in my view, 3 lessons are extremely important that different agencies can do that. As I said, first and foremost is to see that the regional and national networks are linked at the global level, and that evidence collection and ability to absorb those details, I think is extremely important. It can be done at the level of a scientist, but as MARIE-PAULE very rightly said, we can also do with social science, and that kind of learning and cross-learnings are important. The second point is to address specifically the health diplomacy component, and I already listed the 4 components that are there. I don't want to repeat, but I think it is important for us to see how the various contours of multiple actors that have emerged, they are linked. The third dimension is in terms of the cost effectiveness of the solutions that we are talking of. And here we would have to create global mechanisms in terms of how the cost-effective access is ensured to the medical solutions that we are thinking of. And there, the benchmarking, there, the data collection, and there, the ability of global funds to harmonize their standards, to harmonize their clinical trials, and also the pandemic-related specific challenges where open innovation is to be promoted, and we come up with solutions where delicate balance of private interests and public policy objectives are balanced. Thank you.
Thank you. Thank you very much for the closing remarks. MARIE-PAULE, a few words from you to close.
Well, just to say that I think that health diplomacy is very important, and that international health diplomacy is becoming, you know, something also which sets how the world work together. And that it is I think it's the interest of all countries to move out of nationalism, go back to multinationalism, go back to UN agencies, and exercise decent and how they say, a faithful health diplomacy.
Thank you very much. Thank you very much. Benjamin?
No, you know, being the last speaker is always good because my predecessors said it all, and they put it in a very good perspective. Mine is just to thank you and thank also my colleagues. It was a pleasure sharing this panel with you. I think we have some challenges ahead of us, but if we have the will to come together and address these challenges, we will overcome them. Thank you so much.
Thank you very much. Really a big thank to our speakers, and also to the participants who have been very active throughout our discussions. I really have nothing much to add to this wonderful closing remarks from our speakers, But to close the overall series of webinars, I would like to call upon Pascal Grisset, who is from the Sorbonne University, and he is the coordinator of the InsSciDE project. And I would really like him to say a couple of words of conclusion, also building on this last panel, which I thought was extremely interesting and put everything in a bigger perspective. So Pascal, the floor is yours.
Thank you so much, Hannah. I will conclude effectively very briefly, unfortunately not because of a lunch waiting us in the next room, but because we worked a lot during these 2 days. I will catch some ideas in this so fruitful exchanges. After this seminar, we can say that the interaction between concepts and everyday concrete development of diplomatic initiatives connected to science are more than ever obvious. The term bottom-up does not embrace all the complexity of the incessant back and forth between experience and organization or even conceptualization. If, nevertheless, concepts are tools, they are not, at least in the context of Earth diplomacy, the final goal. To deal with science and technology or innovation diplomacy from the point of view of humanities and social sciences is, for a significant part at least, connected on action research. Secondly, I will underline the fact that cooperation cannot ignore geopolitics and the impact of history in a long-term perspective. Else, the goal is obviously universal, but the roads to get there are so diverse. Science and technology diplomacy is a way to help to create convergent trajectories by knowing these trajectories. Pragmatic initiatives associating communication and action are the key, more than dogmatic principles. Third, to share knowledge and data is a priority for researchers dealing with health issues. This point is directly connected to the principle of open science at the center of many discussions yesterday and today. But once again, this universal and more globally humanist vision needs to be implemented in real life, networks, institutions, communication, and diplomacy. Europe could play a key role in these dynamics by giving flesh to a bottom-up process pragmatically based on researchers' enthusiasm. We felt a lot of enthusiasm during these 2 days, and it's very important. Finally, to connect different spaces, scales, and categories. And by the way, different cultures is a key issue. That's why the input from UNESCO was intellectually crucial to organize this seminar. Culture and language, we said Francophonie at a moment, matters to link health, sovereignty, and economy. To do so, we have to consider that institution resilience, the words were pronounced in the last panel, are key elements. Facing a crisis like COVID-19 in a multilateral system, not only for justice, but also for efficiency, means to give birth to more relationships among nations and between nations and non-state actors. To think the future by denying the specific role of one or the others would be a profound mistake. We have consequently to imagine new networking between states, regional organizations, NGO, and international organizations, this different level. Because of its history and experience, I'm convinced that the European Union undoubtedly has a special role to play in this perspective, knowing that it's a very difficult task. I will definitely conclude by thanking all the participants of the panels, to thank a very large audience, and of course, InsSciDE teams and our partner in our consortium and co-organizers from UNESCO, with a very, very special mention for Daniela Palmberg, who played in the shadow of the electronic networks a crucial role for our collective success. Our exchanges will have extensions. You can contribute by following the InsSciDE project and its common actions with the S4D4C project visible on our website. We saw during these 2 days that a lot remained to be done, but also that many positive things were already developing. Others will occur in the near future. We hope to be able to contribute to it at our modest level. Merci à tous et j'espère à très bientôt.
Thank you very much.